We see Healthy Here as a movement to build a culture of health in New Mexico. We're utilizing the collective impact model, and Presbyterian was the applicant to the CDC REACH cooperative agreement, and we partner with the Bernalillo County Health Council, who is our lead coalition. This helps us to really be accountable to the community and make sure that the work we're doing is community-led and driven. And our work is really focused on partnership and building capacity in the community and leverage our resources to do that.
Healthcare is really being transformed from the payment model level, really aligning incentives differently and helping healthcare systems really focus on population health. And so being in the business of not just delivering healthcare, but ensuring health. And so this work is part of that transformation because it extends our reach into the community, helps us really look in a focused way at what are the problems and the social issues and the determinants of health in our population that we can address at a healthcare level, but more importantly, how do we think about them in the communities we serve and program to extend that reach into the communities.
The Health Council, which is BCCHC, is the overarching guiding coalition for this initiative. So our role is actually bringing all of the different organizations and individuals together on the issue of reducing chronic disease in our community by increasing people's ability to eat healthy, to be more active physically, and to be able to make connections with clinical services that they need and the kind of education that they need to be able to take care of themselves.
So the Healthy Here Mobile Farmers Market has been a great opportunity for us to address our healthy eating priority. And through the farmers market, we're able to support local farmers and help to make locally grown organic produce affordable and accessible to communities that don't have access to healthy food.
We have widened the scope of our programs as far as statistics, working with mobile market, working with the cooking classes. We're all partnering in those entities. It has brought Agricultura Network, our services, has linked us with many others that we are working along the same line of community health.
I think the main vision for IDHCC is that the International District be the best place in New Mexico to raise a child. And with that comes creating jobs for folks, helping adult education, just creating that vision where the community is really in charge of its own health and its own direction. IDHCC has been working on pedestrian safety for about 8 years now, and we helped get the word out for people to come to the meetings around Zuni. That has helped to move along the restriping of Zuni. Some others are bike lanes on each side.
With the support of Presbyterian, Kids Cook is continuing to provide the programming that we do in the school, but also positioning our educator as a community health worker so that they can work with individual families on social determinants of health, improving access, and our focus is students' academic success. So being positioned in the school, we're actually seeing this amazing possibilities of having interdisciplinary teams in schools that are not only looking at the students' academic success, but how do we keep that family healthy? And then how do we make sure that they have the access that they need to social services that are going to keep that family healthy?
The Wellness Referral Center is important in many different ways. One of the ways is that it basically backs up the conversation between the provider and the patient. And then in regards to exercise, we have the walking program that some of our employees lead. And then there's also incentives. So they sign up enough, they take part enough, they build up points, and those points can go to things such as Fitbits. And again, it's making the healthy choice the easy choice, where you want to make these dietary changes and activity changes part of the normal daily activity. And the best way to do it is by making it normal.
We have a health plan, we have hospitals, clinics, we employ providers. And so when we take all of those resources, our goal is to really organize those, and leverage those assets to really help improve the health of the patients we serve and the health of the communities we serve.
It's really about building the leadership in the community and having a shared leadership so that you can work towards a shared agenda.
We really want to continue to expand the work of the Center for Community Health. We want to work more in our rural communities, expand our partnerships, and get better at evaluating our work and telling our stories.